All right, so we're going to practice reading this together. So first, for recognizing cues, we're going to be asked in the first question, what's most important? And the NCLEX can ask that a couple of different ways to say what requires immediate follow-up or which however many findings are most concerning, because we can't give the same attention to everything. And so we're going to be looking specifically for unexpected abnormals. Some abnormal findings are expected, right? And don't actually require us to do anything. And then if you're stuck, my next tip is to ask this question for how would I follow up? Because you're going to see that some things that maybe look like priority findings, when you actually think through how you would address it, it wouldn't make sense for that given scenario. So we're going to read this together. And remember, what we're trying to answer here is we're looking for the top 4 findings that require immediate follow-up. We're going to read this together, and I'm going to highlight anything that seems especially important, all right? So for this patient, we've got a 57-year-old male. He's come to the emergency department after feeling short of breath and having a cough for the last 2 days. So visualize this, right? 57-year-old guy, so he's like not yet retirement age. He's short of breath. He's coughing. This has been happening for 2 days. He's been sleeping on 2 pillows, so he's probably upright talking to us, waking up coughing several times at night. Then he's been feeling very fatigued and spends most of the day in the bed or the chair. He appears anxious. We review his history and we find he's got a history of hypertension, hyperlipidemia, chronic stable angina, and diabetes. So this is like cardiovascular disease bingo, right? He's got all the risk factors for heart disease here. He expresses a concern that he can't quite afford his medications. So keep this picture in mind as we move on to our more objective data and the assessment and vital signs, is that he's short of breath, he's coughing, he's got all these heart history risk factors, and which 4 findings require immediate follow-up. Then we perform our assessment. He's oriented, that's good. We listen to his lungs and we hear crackles. We have an S1, S2, and an S3 heart sound. Our bowel sounds are normal, cap refills normal, pulses are, but we've got 1+ pitting edema in our bilateral lower extremities. So add to this picture of this not yet retirement age guy. He's short of breath, he's coughing, he's anxious. Then when I listen to his chest, I hear crackles and an S3. And when I assess his extremities, I find pitting edema. So am I worried about, like, what is my priority problem here? If you guys were, say, making a care plan, what do you think your number one nursing diagnosis? And you can keep it loose. Do we have an issue with breathing? Do we have an issue with circulation? Do we have an issue with volume status? So kind of start thinking about this as we go. All right. Vanessa says she's worried about cough, respirations. Nina says shortness of breath, crackles, respirations, pulse. Yes, I agree with several of these things, you guys, because we are going to be looking for those priority problems of airway, breathing, and circulation, of which he has several. So then we get our vital signs. We find his temperature is normal, but his pulse is a little high. His respirations are a little high. His blood pressure is high as well. And then his pulse oximetry is low. So you guys know, and I don't have to tell you, that when we're looking for the top findings, we are going to prioritize any unexpected findings of airway, breathing, or circulation. And so I'm going to go ahead and check off the ones that you guys have said. You've said breathing, so respirations, right? He's breathing quickly at 25 times a minute, where your upper limit of normal is 20, probably as a compensatory mechanism because his pulse oximetry is low. And that's why he's reporting to us shortness of breath. And remember, when we had listened to his lung sounds, we heard crackles. And so if he has crackles in his lungs, there's something there in the alveoli that is going to be blocking that exchange of gas. And so that's likely the underlying problem. And you guys got it. You guessed several of these, but this is how things happen on the NCLEX, is the distractors seemed just as likely to some of you. So let's talk about why these ones would not require immediate follow-up. So those of you who chose the cough, maybe you recognize that this is a respiratory issue, and that sounds a lot like a respiratory issue. Again, so are the others, but when I ask myself that question of how would I follow up with this, what would I do about the cough? Would I give him a cough drop, have him gargle something? There's nothing really immediate that I can do to help his cough, so it's not going to be that one. Same thing with the edema. Maybe this is definitely an unexpected finding. We aren't told that he has any history of a condition that would explain edema, like peripheral vascular disease, varicose veins, where it might be expected. But again, what am I going to do about the edema directly? Nothing, right? Nothing urgent. Maybe I'd elevate his legs, assess for like the presence of any wounds from venous stasis, but there's nothing immediate that I need to do when I have the presence of crackles, tachypnea, hypoxemia, and dyspnea. Those need intervention right away, probably at least with oxygen, if nothing else, right? Raising the head of the bed if he's not already sitting up. You guys know what to do. The blood pressure. So the blood pressure is abnormal, but we don't know if this is an unexpected abnormal, right? We're told that this patient not only has hypertension, but also that he's been struggling to afford his medications. So he could very well have just skipped his meds this morning, or maybe he's stressed out because he's in the emergency department. So there's really not anything more urgent about the blood pressure than about these respiratory findings. Now, if it said that he had the worst headache of his life and blurred vision and his blood pressure was much higher, maybe then I would need to immediately follow up on that. But it doesn't say that. It just says his blood pressure is 149/93. That can wait. Then inability to afford his medications. What would I do? Would I consult social work? And maybe at some point before discharge I would, but right now while he's short of breath and anxious, he's not going to hear a word that they have to say. History of chronic stable angina. That is going to give us some clues as to what might be causing his symptoms, but there's nothing I'm going to do to address this specifically. So we're going to prioritize these unexpected abnormal respiratory findings of crackles, that's causing a hypoxemia and dyspnea, and then a compensatory tachypnea. And we're right. So Stella's asking, we choose things we can do something about, right? Yes, exactly. If there's something that there's nothing for us to do, like there's nothing for me to do about his history of chronic stable angina, that's in the past, right? Even if the thing you can do as a nurse is reporting to the healthcare provider, in the example of the splitting headache, what I would need to do is prepare them for a CT, right? So it's not necessarily a nursing action, but yes, don't prioritize following up on something that there's no follow-up required for. Good question.